And now Dean Russell's got some questions for Sir Simon on mental health.
Thank you, Chair. So Simon, the questions I've got really are around mental health for patients, a little bit about staff and also communications to staff as well. Firstly, during the pandemic, could you give an outline of the extra pressure that was being put on the NHS around mental health and what was done to meet the demand?
Thank you very much, Mr. Russell. You're right. I think you have heard from my colleague Claire Murdoch at this committee as well, our National Mental Health Director, and Claire has set out some of the new services that were expedited, including crisis care and crisis helplines for patients, as well as a support offer for staff through the pandemic period. But I think the honest answer is there is a big unknown as to how much of an additional burden of mental ill health there will be coming out of the last 4 months. There is some evidence that there will be higher rates of mental distress. The extent to which that is also clinically identifiable mental disorder is being investigated. People like Professor Sir Simon Wesley, the Regis Professor of Psychiatry at King's College London, the Institute of Psychiatry, are doing sort of fact-based empirical investigations on this point right now. So I think, in a nutshell, we believe there will be increased mental health demand, but the precise size and shape of it is yet to be determined and seen.
And thank you. And in terms of that, looking ahead, I appreciate that there's a great unknown there. But based on the need to plan resources and support, can you assure me that the parity of mental health care moving forward and the planning forward will be equal to the care around physical health?
Yes, thank you. I suppose the first thing to say is that, as you know, we have I have committed over a number of years now that mental health investment will grow faster than overall growth in the NHS budget. And looking at the financial year that we've just concluded, 2019-20, I can confirm that once again the mental health investment standard was met nationally. So mental health services grew faster than the NHS overall last year, and in fact that mental health investment standard was exceeded by £200 million or thereabouts. Looking at the year we are now in, obviously we're in completely changed circumstances, so we want to ensure that that commitment remains for the regular work of the NHS, and then for extra costs that providers are having to incur for coronavirus, they have been reimbursed on a sort of at-cost basis, essentially. But one of the things we also know is that too many of the buildings and facilities in which NHS mental health care is being delivered, those buildings are out of date and need a significant upgrade. And that's why one of the things that I personally have been pushing, and I'm really very pleased that the Prime Minister's announcement today gives effect to, is capital investment to phase out altogether so-called mental health dormitory wards across NHS mental health providers. The money we're getting today, part of the £1.5 billion, will enable mental health providers to do that.
Fabulous. And will that help support and decrease the waiting times for children looking for mental health support? I know that's been something for a few years has been a big challenge for many, and I know a lot of parents have been concerned about those waiting times.
Yes, you're quite right. And one of the things, again, that we have committed to and the mental health services are delivering on is a increase in the proportion of children and young people who are getting those specialist mental health services. And for the year we've just come out of, Claire Murdoch and her team and the mental health services managed to expand faster than was planned for last year, but we clearly have got a long way to go. Part of that is a unknown around how much of the mental health needs of young people can be met through, for example, schools-based programs, as against referrals to the specialist CAMS services, the child and adolescent mental health services. And that's why A quarter of schools are now running these additional schools-based models to test out that proposition before a decision is made nationally on what the scaling of the programme should look like.
Thank you. And briefly related to NHS staff and mental health, Claire Murdoch gave evidence a few weeks ago, and I raised at that about not just supporting the NHS staff but also their families, especially during the very intense peak of COVID. She assured me then that families would be reached out to of NHS staff to offer support. I followed up with her since, and she's assured me that that's happened. But I was just interested to know your take on the next few months to support mental health for staff. You'll know, I know you visited Watford General Hospital recently. They've had the sanctuary at Watford Football Club next door. I know a lot of organisations have done similar situations. Is that something that can be continued far into the future to support staff and provide additional well-being care?
Yes, is the answer. I think as necessity is the mother of invention. As you heard from Professor Goddard earlier, a lot of the support that has been put in place during this terribly difficult and trying period for staff has now got to be the new normal for how we provide support going forward. It may be Amanda wants to come in on that point as well, as I know that she's also been actively working in this area.
Amanda, did you want to come in?
I mean, just echo really what Simon's just said. I mean, I think it has been the most unbelievably kind of difficult period for NHS staff across the last few months, and the response, as colleagues have said, and thank you for acknowledging it again, has been completely remarkable. So actually out of that, if we can find some things that have worked well to support our staff through the pandemic that we can now make much more the kind of normal routine offer, then that's very much the commitment that I think I and all my colleagues would have made and are absolutely committed to.
Excellent. And can I ask one final question, please, Sir Simon? My question's about communications. Obviously, Rosie previously asked about comms to or communications to patients. One of the things that seemed to be a big issue, especially during the intense period where PPE was a concern at the start of the pandemic for staff, was it felt like there wasn't necessarily the greatest communication, and some of the anxiety within staff that I heard were fears around what could happen rather than what did happen. So, for example, fear around PPE perhaps not being delivered because it was being over a short period of time, but actually that never actually happened. And so anxiety levels seemed very high. And it felt that communications could have solved some of that. And I was just interested in your take on, your view of what happened around communications to staff during the pandemic, and perhaps if there hopefully won't be a second wave, but if there are intense periods moving forward, how that could be resolved and improved upon.
Yeah, I think that's a fair point, actually. I mean, as you say, although there was no national stock out of any PPE item, the distribution challenge was pretty intense on the Department of Health and the armed services who helped with that, as well, as really the PPE distribution went from serving 238 health service bodies to north of 50,000. So that clearly was I think you're raising an important point there. More generally, I think there's a sense that actually communication on a range of topics has been quite comprehensive, and Steve Powis and his colleague Keith Willett, as well as Ruth May, the Chief Nursing Officer, many of my national clinical team, holding weekly, fortnightly webinars, information sessions, Amanda doing a daily update for the health service. I think there's a sense that actually people have had the freedom to innovate and get on with it, but nevertheless there's been pretty significant communication and support.
Would you just to follow up on that very briefly, perhaps to Professor Powis, did you feel that reached the front line though? Because I felt sometimes, because I'd been volunteering in a local hospital, and I'd felt that sometimes there was a disconnect between what I was hearing as the MP speaking to senior staff and what people on the front line were hearing. That is not a criticism of the brilliant work that the team were doing, but I'm just interested in your view on that. And
I recognise that sometimes can feel or be the case. So it's important that we use as many different communication channels as possible to to ensure that people know what the position is. So on the point on PPE, for instance, the Royal Colleges, the BMA, the RCN are really important routes for us to get message through to that wider constituency of staff. So, for instance, throughout this, I've been meeting regularly, obviously remotely, using technology with the presidents of the colleges, the BMA, the RCN. Until recently, I was doing that twice a week. Twice a week, we would spend an hour on a call together. There would always be a PPE update in that, so that those presidents, those key individuals would know exactly what the position is. We've moved it to once a week now as we've moved into a slightly different phase, but we still give that update. And that allows them to pass on through their channels as well. Similarly, once every 2 weeks, as was once every week, now once every 2 weeks, the chief nurse and I do a similar webinar with medical directors in individual trusts, with other representatives from other bits of the health sector, from chief nurses, so that we can tell them what the position is as far as we can see it. So I think it's not just one route of communication, it's using multiple routes of communication. You can never do enough. You can never do enough to get that message all the way through, but certainly we've been using lots of different routes to try and impart, what we believe the position to be.